Good morning. My name is Sanja. I'm a cancer Pathway Navigator for colorectal team at University Dorset Hospital. I'm in this post since October 2022. I'm supporting teams across the sites. University Hospital Dorset has 3 sites, and I noticed I didn't add Christchurch Hospital, but we don't have a colorectal team in Christchurch Hospital, and patients are cared. We are caring for patients in Poole and Bournemouth Hospital. Both sites, Poole and Bournemouth, they have 2 teams of nurses, cancer nurse specialists and fast track teams. Why I separated those teams, because at Bournemouth Hospital I'm working closely with a cancer nurse specialist majority of my times now, and I'm supporting the advanced nurse practitioner for a fast track team at Poole Hospital. What I'm doing and what my role is within the fast track team is practically tracking patients. I was allocated and I was part of the team who implemented FIT negative pathway, which is the patient who are, we separated patient who had negative FIT on the beginning of the pathway, and they were cared separately. So I was this FIT 10 pathway was run by hospital and fast track team for a year, and now is responsibilities of GP practice. Another thing which I'm dealing is with the phone calls, whether is calling the patients regarding the FIT bloods or any other queries where they DNA, for example, or of course when I'm booking them into follow-up on all the first appointments as well. I'm contacting the GPs, and maybe some of you are familiar with my name because I'm pretty annoying person regarding that, because I just need to have results, isn't it? And then I'm also requesting bloods and FIT tests on the clinical system for nursing team. I'm chasing investigation results, histology results, and I know one of my colleagues, Pathway Navigator for histology at Bournemouth, probably slightly cross with me with all my emails, but I just want to ensure that we have histology reports as soon as possible to update patients whether there is a cancer or not. And I'm lucky to say that when I'm calling patients, I will reassure them, and I'm saying I'm calling them without, they don't need to be concerned, because I'm supporting them and I'm the person who is delivering good news sometimes. And also tracking the reports once the investigations are requested. My responsibility is to track those results, to read all the CT scans or, for example, colonoscopy reports, and to highlight to the nursing team if something is bad, unfortunately, so we can speed up, so we can add patient on the MDT discussion, and so we can go. The difference, there is a massive difference between fast track team and their way of working and obviously cancer nurse specialist. So when the patient is diagnosed with a cancer, they will have first contact with the cancer nurse specialist. For the CNS team, I'm the person who is dealing with the majority of the phone calls. I'm picking up the messages on answering machine, and if I can deal with the question of the patient, I will give them a call, or I will seek advice from the CNS team, and then we'll call patient back. If not, I will signpost the patient to the correct nurse, or depend on the patient question as well. I'm attending every weekend all the pre-MDT and MDT discussions. I'm preparing some of the patients documentation for the MDT meetings as well. I'm tracking also for CNS team, I'm tracking complex patients. Well, I think all of them are complex. However, we find out that within the CNS team, the patient on the fast track on the first 28 days, they are really good supported. So they will have, for example, first telephone appointment, they will book for investigations. And then once the patient is diagnosed with a cancer, and by the point that they are picked up by the cancer support worker in colorectal specialty in Bournemouth, they will be practically on their own, just within the nurses will take care of them. So I'm supporting patients in this gap between diagnosis and the treatment, and some of the patients will be sent to other trusts like Basingstoke Malignancy Institute or Southampton Hospital or Salisbury Hospital for further investigation. So I will keep eye on them. We don't want to lose them as well. All the images which needs to be reports and images which needs to be sent to another trust, I'm the person who will ask our IT team to forward those images, and just will keep eye on the clinical systems, whether we send them or whether we receive the images as well. And also patients who are in surveillance. Nurses will highlight, for example, patient who, to me, which CEA level, for example, had risen since last blood test, and then I will keep eye on their CT reports or something like that, and of course highlight it to the nursing team if they need discussion, and or will message the MDT facilitator to add them for another MDT discussion. We can go on. So difference between the Pathway Navigator's role, from my understanding, and within the UHG team is it's different. So at the moment we have 5 navigators at the UHG. So I'm focused on the patients. Majority of them, they already were discussed on the MDT team. I'm not the person who is tracking the fast diagnosis standard list of the patient as well. I'm in constant contact with the patients. I pulled out some data for myself, and according to the SCR, I'm in a post now for 17 months. For last year, I had more than 780 contacts towards the patients. So I think it's a good thing, because the patients are, I would say, supported during their pathways. And I'm now integrated part of the nursing team for both sides, for the fast track team at Bournemouth and CNS team in opposite Bournemouth CNS and Pool fast track team. Some of my colleagues, I know they don't have, for example, contacts with the patients at all. They are tracking patients on a PTL list. They're running histology reports, for example, collecting data or something like that. So the roles are different within the teams, and I probably at least I found myself working more comfortably with CNS team, and they're happy for having me there. So it's dependent between the teams as well. When we started as a Pathway Navigators, we were managed by MDT team. We were shadowing MDT facilitators on the beginning, because the role were not recognized, I would say. So we were practically pushed to work with MDT facilitators, and we were chasing numbers rather than contacting the patients. Some highlights of the role and challenges as well. So for highlights, I said patient satisfaction, because I'm tracking patients practically. I have a lady who I supported first when she was referred to fast track. She was diagnosed with a cancer, and I'm still communicating with her, because she's a cancer patient now. She has all these investigations, and it's nice when I'm calling her and she knows my name now. So I'm trying always to support and to answer all their questions as well. Belonging, I would say I'm part of the team. It's nice to be part of the team, to feel welcome in the office, to do a Secret Santa, for example, as well. And then learning, I believe I really expanded my knowledge about the cancer and the service. My background, pardon, is nursing, but I came from different country, and we don't have all this supportive workforce in my country. So being part of this lovely team, it's really nice. And then networking, I have daily practically contacts with the team from different external trusts. I've spoken to one lady from, forgive me if I will say wrong, Guernsey. So it's really nice to have this conversation as well. And then challenges, obviously, and I believe it was with the cancer support workers when you guys started years ago, it was challenging to introduce the role. Hot desking, I believe some of you are familiar what that means. Of course, working for two sides of the hospital and having 4 different nursing teams, it's really challenging. So since September last year, I practically allocated myself. I said, I'm selfish now. I can't work with 4 nursing team because there is a 4, different way of working, and you need to support them, so it's really challenging. However, now majority of my times I'm with the CNS team and I'm enjoying to work closely with them. That's all from me, thank you.
I'm Vicki, I'm a Pathway Navigator for Gynae and I work at Hampshire Hospitals on the Basingstoke site.
Thank you. Can you tell me what you're doing to support your patients?
Sure, so every referral that comes in from the GP, get the referrals in on a daily basis. I phone every single one of those patients, talk to them about when their appointment's going to be. I talk them through everything to expect from that appointment. So all our gynae appointments are usually one-stop shops. So the patient is going to come in, they'll have a consultation, they'll have a pelvic examination, which is similar to a smear, and they'll also have a transvaginal scan. And I also let all our women know that transvaginal scan is actually an internal scan, because quite often they don't know that, and they like to maybe do a bit of housekeeping before they come for those scans. So I discussed everything with them. I let them know that about 50% of the women, when they come in, they'll have biopsy taken of some sort, and to be prepared for that, the consultant will discuss with them first. And then if they've got any questions, I'd make sure they've got my number to call me back. And quite often women come back and go, can you just run through this with me again? Just because they're taking in all the information that you're giving them. And then they will call back and, sometimes they want to change their appointment because something's come up. I do have some women that phone and go, I can't make that appointment, I can't make this appointment. And I do gently remind them that it's their health. And I've had one woman on the phone going, oh my goodness, I've put my work before my health. And I was just like, she was really shocked with herself because she'd done that. And I know we all do that, but she was really shocked. And then some women, unfortunately, I do have to let them know that they've been put onto the cancer pathway because the GPs failed to inform them. The GPs are very good at telling them they're going to put them on the fast track pathway, but they don't let the patients know that the fast track pathway is actually a cancer pathway. And some women are quite shocked to find that out. But they take it quite well, and they're right, I'll phone my GP and find out what's going on. And I do signpost them back to speak to their GP at that instance, because that's something that the GP should have informed them.
Okay, thank you. And can you tell me a bit about the team you're working with and how you're supporting them as well?
Yep, so I work within the booking team. So I sit on the ground, again, I hot desk, but I sit either with the booking team, with the secretarial team. And so I'm integrated within them. The consultants sit in the office directly next to me. So I'll pop in and see them. If I have a query come up with the patient, I pop in to see them. The consultants come in to see me. They've had a clinic, I can take these people off the track pathway. So, straight away after the clinic, we'll sit down and discuss which patients I can take off the pathway, which patients are going on to have further investigations. I track those investigations on Somerset, so every patient has got tracking notes on there so whoever goes on Somerset can see exactly where that patient is within their pathway. For instance, I had a patient that had been transferred over from sarcoma yesterday. Her referral came in from the GP at the same time, we printed it off, printed off CT reports, went to see the consultant, and within 20 minutes we'd got the appointment for the patient. She's a recurrence of cancer, so patient's got the appointment, she's got an appointment with the CNS nurse, and she's also been put on MDT for this Friday. So, because you have that close working relationship with the teams, you you can pop in and just I knew where the consultant was, I knew her clinic started in 20 minutes, so I popped up to see her in a clinic room, sat down, discussed it, she made the decisions, and hey presto, the lady's in this week and going on MDT on Friday. It's
brilliant, thank you, great example. And let's finish with the highlights of your role. What are the things you really enjoy?
I love speaking to all the patients. There's such different expressions that you get coming back from people, and everyone's really grateful that they've had that phone call, they've had that chance to talk to someone and they're not coming in blind. They're really grateful to know what to expect when they're coming in.
Thank you so much. Well done to the Pathway Navigators and to all of our speakers this morning. Thank you.